Next up is Kristie Matule. She's LAC, LCPC, working with Life Management Associates at the moment, and she's going to talk to us about addiction. Yes. Well,
That's fine. I just don't want to fall off as I'm writing this. So first, can people hear me? Oh God, it's weird to hear your voice up here. Thank you. I know that's really intimidating. Probably spend the whole time doing that. So I don't know if anybody else was super nervous, but this is like the first time I've ever done this before. So I'm really nervous. I just feel like this intense pressure. Did you guys feel that way? Like, did you?
Yeah.
Okay, well, mine's not quite as personal, but thanks. Okay, so I'm going to talk about addiction as a disease. And so how many people in here work with individuals who struggle with substance use disorders or, oh, excellent. So you know the struggle. It's challenging, frustrating, and all of the things. So I'm going to ask a few questions, and I'm going to write some things down. I don't have a PowerPoint, which actually is probably good because I probably panicked when that happened. So how many people in the United States suffer from addiction? And this is from 2015, and I would imagine it's grown. But in 2015, there were approximately 21 million people in the United States that struggled with substance use disorders. And about 50,000 in 2015 died of overdose. And that's just in the United States. And I'm sure that that number has gone up, especially with the increase in fentanyl use, especially, I mean, I know in this community for sure. Okay, so I'm going to ask a question. So I want to talk about the characteristics of addiction. So things that you see when it comes to people who are addicted. Like if I talk about the characteristics of the room, I would talk about, the shiny pillars, this looks like sheep's wool or something. I would talk about those things. So I'm going to get my trusty marker and just shout them out to me.
Isolation.
Yeah, it's fun at first, right? This is great until my life falls apart. What about like some of the socioeconomic factors like poverty, homelessness, right? So I wanted to really, what? Legal.
Nobody's breaking the law.
Which, I'm gonna go around this just terrifying. Which I'm super glad that you said they like to break the law. Love that you said that so much. Right. So, if I think about addiction as a choice, right, which for some reason there is still this debate on whether it's a choice or a disease. It's like there's almost still this perception that it's based on opinion rather than fact, right? So when I think about is addiction a disease or a choice, I'm like, why would 21 million people in the United States in 2015 choose all of this? Why would they choose all of that? I can't imagine somebody waking up in the morning and saying, I cannot wait to break the law today. I cannot wait to not have any money. I can't wait to be homeless and have no coping skills. That's a great day. That's never our goals for our lives. And that isn't for these individuals either. And so I want to start by saying, so the brain is built to survive. And there are three things that people need, and we can argue this all day long, but I want to talk about just three things that people need to survive: food, water, and dopamine. Dopamine is a chemical response for motivation, right? It's a neurotransmitter in the brain. It's a chemical messenger in the midbrain that tells us what to do to meet our needs. Like, what do we need to survive, right? So too much dopamine production leads to an imbalance, right? And causes like the prefrontal cortex to suffer. I'm not a doctor, so I don't, have I don't have a picture of the brain and stuff like that. But I think, it's kind of like the way the liver is meant to regulate toxins in the body. But if its constant focus is to get alcohol out of the system, then it neglects its other duties. So that's kind of how I like to think of the brain when it comes to an increase in dopamine production. Let's see. I might say a lot too. If I do that, just feedback afterward would be great. So dopamine drives humans to meet their needs every day. That's what it does. If we're hungry, then we'll go eat. Okay? So about on a normal day, let's say just a regular day, you go to work and it's not a bad day, it's just a typical day. The brain releases 50 nanograms per deciliter of dopamine. Okay, so that's an average day, okay? On a bad day, like you have no motivation, you're in your pajamas all day, you just want to watch Netflix or whatever, you're at about 40 nanograms per deciliter. What do you think? So on a natural level, so I'm talking like, obviously like thinking about hugs, food, natural things that release dopamine into the brain. What do you think is it releases the most dopamine outside of substances? I thought that too, which is weird. It's not the highest. So your favorite food is actually the highest. Favorite food, which really explains a lot for me personally, is 94 nanograms per deciliter. Sex is 92. So it's a close second, but I guess the brain does know how to prioritize what we really need versus want. Okay, and on your very best day, let's say you're at the beach, you win the lottery, you eat your favorite food, and you have sex. It's like the greatest day of your life. Greatest. What do you think the maximum amount of dopamine is released in the brain on the very best day? 100 nanograms per deciliter. Close, Bill. It's nice. Usually people are like 500 or something like that. So then you add in substances, which unfortunately is much higher than that. So tobacco, and I'm speaking for this as a smoker, and so it's kind of embarrassing. Tobacco initially releases 450 nanograms per deciliter in the brain, which, is an intense pleasure, right? Alcohol is about 450 as well. Alcohol and tobacco are about the same. Marijuana is 650. Opiates is 975. And methamphetamine is 1,100 nanograms per deciliter. So if you think about your brain functioning on this normal level, and 100 is on the greatest day of your life. Somebody uses meth one time, they've never felt better. It's never been a better feeling when you first start using methamphetamine. Yeah. So even though that campaign really didn't work, the Montana Meth Project, there was a lot of concerns with it. That not even once does make a little bit of sense, right? Because there is that intense pleasure right out of the gate. So once this happens, once we start getting that much dopamine in the brain from substances, normal things like hugs, food, love for another, any of those things, they are not going to do what our brain thinks it needs anymore. And the drug becomes the priority. So with addiction, though, dopamine release becomes less over time. So they end up needing the increased levels of dopamine to feel normal. However, removing the drug from the brain leaves the brain creating only 10 to 20 nanograms per deciliter, meaning I can't even get out of bed. I can't even muster the motivation to get out of bed. So a lot of people ask the question, how can they steal? How can they lie? How can they do this? How can they cheat? Why do they do all of these things that hurt other people? Why? And so when I go back to those insane amounts of dopamine, I'm like, well, that's why. Because the brain is telling them that's what they need to survive. It now prioritizes the drug over food, water, everything else in their life. Nothing else matters. So then not having the substance, leads to craving. And the problem is once a person becomes addicted to a substance, meth starts out as 1100, right? But over time, it drops. With continued use, the dopamine drops. And so, 1100, 9, 8, 4, it goes down the line until you get all the way back to 50, where, remember, that's a normal day. And somebody needs like methamphetamine or opiates to feel just normal, because it only releases the high dopamine for a period of time. So not having the substance, again, leads to craving, searching. So the brain is constantly searching for what it needs to feel normal. And remember that dopamine drives humans to meet their needs. So the DSM-5 defines mental health disorders, and addictive disorders are based mostly on the behavior of a person, right? And so if you think of there's 11 criteria, only 2 out of the 11 are pharmacological. The rest are behavioral. So the symptoms of the addiction are the behaviors associated with it, right? Like the poor interpersonal relationships, like was mentioned. All of those types of things are all behavioral, and that's how you diagnose a substance use disorder. And so that's a huge thing, and I have this bolded and capitalized on here. So the behavior is a symptom of the disease. It is not something that a person just can't wait to do. And not that we have to I'm not saying that family has to necessarily tolerate negative behaviors, but if we as a community, as a system, start to think, well, maybe if the behavior is a symptom, we can look at it a little bit differently than we do. Because there's a huge stigma surrounding addiction, huge stigma. And so the definition of a disease is any harmful deviation from the normal structure or functional state of an organism, generally associated with certain signs and symptoms, and a diseased organism commonly exhibits signs or symptoms indicative of its abnormal state. And so addiction fits those things. The effect is on the brain. There are signs and symptoms associated with it outside of the person's abnormal state. Because typically people will say, well, when they're sober, they're great. They're great to be around. They don't steal, they don't lie, they're pleasant to be around. And so outside of their abnormal state is a part of what classifies a disease. Sorry, I'm just here. So identifying the cause of a disease is necessary to identify proper course of treatment, and that's with anything, right? Anything needs to be diagnosed in order to be treated. And I would love to go into like treatment and all this stuff. You could talk about this all day long, but we just don't have enough time. So there was a study done, and if anybody needs sources or anything, I was not prepared for that, like slides and stuff. So I'll be happy to provide those. I'm definitely not the researcher on these things. So there was a study done, and there were MRIs done of a mass amount of people, of their brains. So there were a group of people that were in dehydration. So 3 days without any liquids, which I think about that and I'm like, I'm thirsty. So 3 days without liquid, and they put them in the machine. And while they're in the machine, they talk about waterfalls, they played sounds of water, they sprinkled water on their feet to see how the brain would respond to that particular like exposure. And so I want you to think about relative sizes. So obviously, like if you think about, they're talking about relative sizes here versus actual sizes. And so they use the relative size of a baseball for dehydration. So this part of the brain, it's anterior cingulate gyrus. It lit up to the relative size of a baseball for those individuals. And so starvation. So then they studied people who were in starvation. So 5 days without food. They talked about their favorite food. They brought it in, had them smell it. They even had them take a bite and spit it out. It sounds like the worst. It's rude. And it lit up relative size of a basketball. So then we talk about a person who's addicted to a substance. And it was just 1 or 2 days after their last use. The only thing that these individuals were asked was when they first used and their last date of use. Those were the only 2 exposure questions that they were asked. And it lit up relative to the size of a baseball field in comparison to the individuals who were starving or dying of thirst, right? And so just to give some perspective of how the brain responds when it does not have what it's looking for. And I think about, God, a baseball field? At first, when I watched this video that gave me some of this information, I was like, oh my God, and I think I have problems, you know? So I ask again, and I keep asking this because I think it's just really important to answer this question with some of this information is how can they steal? How can they lie? How can they cheat? How can they hurt us? Because their brain is altered. The brain chemistry is completely altered. It now prioritizes the addiction over anything else in their life. And so I think it's important to talk about stigma because it's very frustrating. It's very frustrating for us as professionals that work with individuals who struggle with substance use disorders, as well as those who struggle themselves. It's like this taboo thing to talk about, and it's like somebody who's struggling with addiction it's almost like, oh God, they're automatically a problem. And yeah, there are problems, but because of the fact that they have this disease, it has nothing to do with the fact that they chose to harm other people in their lives. So stigma to me in this topic is more like discrimination. I feel like that population is discriminated against rather than treated like they have a disease, like they're a patient who has a disease. And I don't think that's very fair. And I mean, hospitals across the country, if there's not a behavioral health hospital, there's nowhere for people to go. They get turned away a lot of times. Versus a person with chest pain, which is a very serious issue. It could be a heart attack. But then somebody who's addicted is treated so much differently. And I really want to speak to the fact that they're human beings. Everybody's a human and we all have struggles, whether it's mental health, medical, addiction, doesn't matter. We all have struggles. And I think it's really important to acknowledge that one is not necessarily more important or more severe than the other. Um, so I leave with a few things, just a few statements. And this disease is science. It's not an opinion. It is not an opinion anymore, and it hasn't been for a long time. It's not an opinion. And I think for kids, there needs to be knowledge and education provided versus scare tactics, because obviously, like we just talked about, that doesn't work. So it is a predictable chronic disease. It's not a moral failing. It has nothing to do with the fact that you have poor morals, you were taught wrong. Yeah, there's genetic predisposition, but it doesn't, and environmental factors, but how is that their fault? It's not really. So I feel like I'm good on time. And I took longer than 10 minutes. This is a victory. So I don't know if anybody has any questions or anything. I don't know if you do. Try. Yeah.
What I think is that for the issue between a disease or a failing, that if you are the family of the individual with the disease and you are the one being impacted, especially as a child, you look at it as a failing. You look at it as he's just a mean old man. If you then get away, you look at someone else and it's not directly impacting you. I think it's a lot easier to swallow as a disease. And I don't mean swallow like I don't believe it.
Right.
But I think that's really a crucial point when you're talking about the family. Because the family is the one who's getting it 190%. Rotten, nasty, feel for them, what don't care about you, blah, 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 blah. And then you try to tell the family it's a disease. Talking rock, it's not in the film.
Right.
I think it's really important that they're aware that it's a different view.
Right, because it's frustrating. It's very difficult to be a family member of an addict. I mean, I have one myself, and it's been the most difficult thing. And I've had to set boundaries and set limits for myself that don't expose me to that, because I have to take care of myself. And I always encourage families to do that. I encourage families to engage in therapy because it is exhausting. Addiction is a family disease. It is an exhausting thing to deal with for families. So I can totally understand that. The person who, I mean, I have this person in mind who would argue with me all the time about the fact that it was a choice, a moral failing. Had a mother who died from cancer. And so it was this argument about, well, cancer is a disease, addiction is a choice. My mom didn't choose cancer, right? And so those are difficult topics because there's somebody who's connected to somebody else who died from a different disease. And so I try to, tread lightly with those people, because although he was kind of frustrating and on a personal level, so I was just like, listen. But with other individuals, I tread lightly and just try to educate and explain, because maybe if they understand, they'll try to look at it differently, but also set limits for themselves.
I do have a question that's actually a statement.
It's not a question. So.
As a recovering addict, being introduced to the disease model in treatment was huge for me. And so, in interactions with people struggling with substance use disorder, it's a wonderful tool. It's not just for families, but for the users as well, because it's. I'm thinking about that Gabor Mate documentary that was mentioned. Like, it moves you from a place of disempowerment to empowerment. Like, you can take action on a disease. If it's a moral failing, then all I am is shameful. And yeah, so I really appreciate it.
Yeah, I think that's true. Yeah, it's like, what's wrong with me? How many times have people said, what's wrong with me? There must be something wrong with me, that I can't do this, that I can't stay sober. I want to, I should, but I can't. Well, this is why.
training employees for mental health care. We're gonna do that. That's why we see so much in the quote earning disease. The other thing is that you don't do a very good job of telling people that if their mental health is not working, they did not fail those meds. Those meds failed them. And they keep working. So I think that part of us mental health providers and quote SUV providers, I think we have to recognize that we're asking people to wait, maintain, and then we're not understanding why it's doing. So it's really such a dilemma that we have to open this.
And I just would challenge people to think about what we've heard, today as far as treating people with respect and kindness. Like we would want to be spoken to, like that golden rule. Treat others as you would want to be treated, no matter the situation. Because I promise you, nobody chooses this. Not one person I know would choose this. So, thank you so much.